Hello, my name is Lauren, and I'm a registered dietitian with Rock Valley Health. Today, we're going to be discussing the science behind weight loss medications. Our featured topics include when to consider weight loss medications as treatment, how weight loss medications work, the different types of weight loss medications, side effects of weight loss medications and how to manage these, nutrition and lifestyle considerations when starting weight loss meds, the importance of working with your healthcare team, and lastly, the future outlook for these medications. So, to consider weight loss medications as treatment, ideally we want to focus on lifestyle interventions first. These are going to be dietary changes, exercise, and behavior modifications. Weight loss meds can be considered if you are unable to lose or maintain weight loss with these lifestyle interventions alone. And the rationale for weight loss medications is often based on body mass index, which is a ratio of height to weight. So a BMI of 27 or higher is the overweight category with any kind of presence of other chronic health conditions, things like diabetes, heart disease, that can warrant the need for weight loss medications. And then these other BMI categories are all in the obese category. That would be a rationale for considering weight loss medications as treatment. And then important to note if an individual has a BMI of 40 or higher, bariatric surgery may also be considered as an option. And very important to note that weight loss medications can legally only be prescribed by physicians, physician assistants, nurse practitioners, and some pharmacists, and they should not be prescribed without behavioral counseling. So, how do these weight loss medications work? So, the most popular weight loss medications on the market, things like Ozempic, Wegovy, Mounjaro, these amplify a hormone called GLP-1. GLP-1 is naturally produced in our gut in response to eating, and it signals feelings of fullness to the brain. So, when this hormone is amplified more than usual, it's going to suppress your appetite even further, cause you to eat even less than usual, leading to weight loss. These medications also help to slow your digestion and balance blood sugar levels, which can also be beneficial for weight management. And these weight loss medications also help to eliminate food noise, ideally minimizing constant thoughts about food and causing less impulsive eating behaviors overall. So, different types of weight loss medications. Most of these that are popular on the market today have only been approved by the FDA in the past decade or so. Most of these involve once weekly injections and are used for type 2 diabetes management and to also lower cardiovascular disease risk with weight loss as a side effect because they do work to amplify that GLP-1 or that fullness hormone. And then there's also another medication that's prescribed for alcohol and drug addiction, depression, and smoking cessation that are pills that can be prescribed for those conditions that can also cause weight loss. So, moving on to the side effects of weight loss medications and how to manage these. Gastrointestinal side effects, things like nausea, vomiting, diarrhea, and constipation, are the most common here. Also, delayed gastric emptying is a common side effect, and this is where digested food takes longer to move from your stomach to your smaller intestine. So, you have more consistent feelings of fullness and minimal appetite. So, really important here to prioritize smaller, more frequent mini meals and snacks versus just having three large meals per day. Also, considering liquid supplements can be beneficial, things like protein shakes, smoothies, and yogurt drinks. And to minimize any kind of nausea or vomiting the day of injection, it's important to have your largest meal before that and have low fat meals for the rest of the day. Again, focusing on small, more frequent meals throughout the day, prioritizing healthy fluid intake, minimizing beverages that have lots of caffeine or are carbonated, and then also varying the injection sites every week. For constipation as a side effect, it's really important to make sure you're getting enough fiber. So, from fruits, vegetables, whole grains, and beans. Ideally, 25 grams a day is the fiber goal for women, and 38 grams per day is the fiber goal for men. Also, important for constipation, you want to maintain consistent hydration as you increase your fiber intake, as well as regular physical activity. For constipation, you can also consider fiber supplement powders if you have early feelings of fullness, so things like Metamucil or Benefiber. And then to manage diarrhea, we want to focus on a lower fiber intake. Not 0 grams of fiber completely, but we still want to make sure you're getting some fiber in, just not the um, 25 grams for women or 38 grams for men all at once. So ideally starting with 10 to 15 grams per day as that diarrhea persists, and then gradually reintroducing fiber sources gradually. And then with diarrhea, we want to avoid the use of any kind of fiber supplement powders. So here are some nutrition and lifestyle considerations when starting weight loss medications. So really focusing on smaller portions, your meal timing, having consistent eating occasions and not skipping meals. Also important to not rely on hunger cues alone because those feelings of fullness are even more amplified. So you might be way less hungry or not even hungry at all. So even setting a timer to make sure you're eating enough throughout the day can be beneficial. Limiting high fat, greasy, and spicy foods. And then important to note to consider supplements because nutrient deficiencies may occur because you're not eating as much as usual. So protein, fiber, and fluid are important considerations as well. You want to include protein at every eating occasion and spread it throughout the day. Protein supplements can also be considered, and then also making sure you're getting adequate fiber and at least 64 ounces a day of healthy fluids. And physical activity should also be prioritized, ideally 150 minutes a week of aerobic activities, things that really get your heart rate up, like brisk walking. You can start with low impact activity and make modifications as needed. And also important to note, we want to gradually progress to including some sort of light strength training because we still want to maintain your lean muscle mass. We don't want you to be losing muscle when you're losing weight as well from these medications. So, the importance of working with your healthcare team. The use of weight loss meds should be closely monitored by a healthcare professional with frequent check ins. These check ins should include counseling on dietary changes, physical activity, and behavior modifications versus just doubling the dose of the weight loss medicine without any additional counseling or education. Really important also for healthcare professionals to refer out to registered dietitians or other therapists to make sure that side effects and nutrition concerns and behavior modifications are being managed effectively. Lastly, what does the future outlook for these weight loss medications look like? So, we know that consistent long term use of weight loss medications is going to result in that sustained weight loss or weight maintenance due to amplification of that GLP-1 or that fullness hormone to suppress your appetite. It's also important to consider pros versus cons with these medications. Some individuals are just not able to manage the side effects, medication shortages exist, and there can be risk for eating disorders. Also, weight loss plateaus or just weight plateaus in general are likely to exist. However, that does not mean that medications are not working. And future research is needed regarding reducing the dosage and frequency of these medications once that desired weight loss is achieved, because we know if you stop these weight loss medications completely, weight is going to be gradually regained. So it's even more important to prioritize healthy eating behaviors and behavior modifications in addition to using these weight loss medications as treatment to really make sure you're set up for long term success with achieving your health and wellness goals. So I hope this presentation today helps you learn more about the science behind weight loss medications. Thanks for watching.